The following is a summary and review of magnetic resonance imaging prognostic factors for survival and relapse in dogs with meningoencephalitis of unknown origin. Canine meningoencephalitis of unknown origin, MUO, is a term used for autoimmune diseases of the central nervous system (CNS) and consists of various inflammatory diseases that can only be confirmed through histopathology. These diseases include granulomatous meningoencephalomyelitis (GME), necrotizing meningoencephalomyelitis (NME), and necrotizing leukoencephalitis (NLE). Despite treatment, MUO can be fatal, with a 25 to 33% mortality rate within 1 week and 44.5% within a year of diagnosis. Several studies have identified potential prognostic factors such as younger age and early diagnosis, while seizures and mentation changes indicate a worse prognosis. Neurodisability scale (NDS) was recently proven to be useful in predicting outcomes, with higher scores being linked to a higher risk of death and long-term relapse. Magnetic resonance imaging (MRI) is commonly used to diagnose MUO, and identifying MRI features linked to a prognosis would be beneficial. Previous studies have shown that mass effect, effacement, and foramen magnum herniation are associated with a higher risk of mortality but not long-term outcomes. Studies on humans with multiple sclerosis (MS) suggest that MRI findings such as lesion load, lesion distribution, and brain atrophy may be linked to long-term outcomes and relapse. Due to similarities between MS and MUO, it is possible that similar variables may prove useful in predicting outcomes in canine MUO. The purpose of the study is to evaluate the prognostic value of different MRI variables when predicting survival at 12 months and long-term relapse, and identify specific MUO subpopulations at high risk to improve treatment efficacy. 2. Materials and methods. To retrospectively review medical records of dogs with MUO, the Small Animal Teaching Hospital SAT of the University of Liverpool and the Royal Veterinary College (RVC) examined records dating between years 2016 to 2022. Ethical approval was obtained from the Ethics Committee of the University of Liverpool, VREC 840, before use of data. Dogs included in this study met the following criteria: had a clinical examination consistent with focal or multifocal intracranial neuroanatomical localization, were older than 6 months of age, had multiple, single or diffuse intra-axial hyperintensities on T2, weighted magnetic resonance imaging (MRI), and had mononuclear pleocytosis, total nucleated cell count, TNCC, greater than 5 on cerebrospinal fluid CSF analysis. Dogs were excluded if pleocytosis was not found on CSF analysis, except those with signs of raised intracranial pressure (ICP) on imaging studies. The following information was extracted from the medical records: age, sex, neuter status, breed, duration of clinical signs, and survival information. The neurological examination findings from patient files were used to assign the neurodisability scale (NDS) score. Dogs' MRI scans used a Philips Ingenious EX, Philips Healthcare Scanner, T2 weighted images, T2W. Fluid attenuated inversion recovery flare and pre and post contrast intravenous injection of 0.1 mol kg of gabapentinate dimeglumine, T1 weighted images, T1W, were obtained. Dogs' individual brain lesions were recorded based on location, number, focal or multifocal, contrast enhancement, mass effect, loss of cerebral sulci, transtentorial herniation, and foramen magnum herniation using the same assessor for all dogs. Dogs' brain was divided into 3 major brain zones, which were further subdivided into 15 brain regions. Statistical analysis was performed in which continuous data was assessed for normality using the Shapiro-Wilk test. Descriptive statistics were reported, and intra-observer reliability was determined using the intra-class correlation coefficient (ICC) estimate. The Spearman's rank correlation coefficient indicated the correlation between lesion load on T1, T2, flare, and T1 post-contrast sequences and NDS score, age, and duration of the clinical signs. Univariable binary logistic regression helped identify MRI variables associated with survival at 12 months after diagnosis, and Cox proportional hazards analysis identified MRI variables associated with long-term relapse using the same approach. 3 results. Out of 138 dogs analyzed, 71, 51.4%, were females, and 67, 48.6%, were males with a median age of 51 months, IQR 25 to 73. The breeds most commonly affected by lesions on the MRI were pugs, chihuahuas, Maltese terriers, and West Highland white terriers. Clinical signs lasted for a median duration of 7 days, IQR 3 to 14, and the most common location of lesions was the white matter tracts of the corona radiata and corpus callosum. The statistical analysis revealed that there was no significant association between age, sex, or duration of clinical signs and the lesion load on the MRI. However, a higher NDS score was associated with a higher T2 lesion load, flare lesion load, and T1 lesion load. Furthermore, lesion locations were frequently associated with neighboring areas. All dogs received immunosuppressive doses of dexamethasone at the time of diagnosis. Additionally, 84.6% of the dogs received cytosine arabinoside, while some owners refused treatment for their dogs. The drugs used for long-term immunomodulation varied among patients. 75% of the dogs recovered fully, and 47.8% remained alive for 12 months following treatment. Lesion load on any MRI sequence did not affect the outcome of the treatment, but dogs with a smaller T2 lesion load had a higher likelihood of survival at 12 months. Relapse occurred in 57.5% of the dogs that survived to discharge, with higher T1 post-contrast lesion loads associated with relapse. There was no significant evidence of an association between relapse and sex, age, or duration of clinical signs. In conclusion, this study provides insights into the clinical characteristics of dogs with suspected meningoencephalitis of unknown origin. The findings suggest that smaller lesion loads are associated with a better prognosis for the dogs. Further research is needed to corroborate these results. For discussion, this study is the largest of its kind to evaluate MRI prognostic factors for survival and relapse in MUO. The findings show that dogs with lower T2 lesion load have a higher likelihood of surviving 12 months after diagnosis, and that a higher T1 post-contrast lesion load is linked to relapse. In addition, an association was found between higher NDS scores and higher T2, flare, and T1 lesion load. Of the major brain zones, the superficial zone was the most affected, with the white matter in the corona radiata and internal capsule being the most commonly affected areas. The study found no association between major zone affected in survival or relapse. Previous studies have shown that mass effect, loss of identifiable cerebral sulci, and foramen magnum herniation were significantly associated with increased mortality risk, but this study was not able to replicate these findings. However, this study found that a higher NDS score was associated with increased risk of death within 6 months after diagnosis and incomplete resolution of clinical signs within that time, as well as long-term relapse. A composite predictive score based on the best individual predictors could be generated through a combination of clinical and MRI findings for the improved prediction of disability in dogs, as has been shown in human medicine. The study found the contrast enhancement was present in approximately 3/4 of dogs with MUO. The presence or absence of contrast enhancement itself was not linked to survival or relapse, but higher T1 post-contrast lesion load was associated with relapse. Approximately 2/3 of the dogs presented multifocal lesions on MRI. The study found no association between focal versus multifocal lesions on MRI and outcome. MRI is an essential tool for diagnosing MS, and it is also used to assess patients during follow-up, guide treatment decisions, and predict the course of the disease. In dogs with MUO, repeat MRI and CSF analysis at 3 months after diagnosis were found to be associated with a good outcome. Despite the controversial gold standard treatment for dogs with MUO, identification of MRI variables associated with worse prognosis in dogs can alert clinicians to the potential benefits of more frequent re-examinations or repeat MRI to monitor treatment responses. Several limitations of the study include that treatment protocols were not completely standardized due to the variant treatment options available. Additionally, the study included several dog breeds with a large variability of head and brain size, making the calculation of lesion burden uncertain in some cases. It was not always possible to define and delineate lesions clearly, which may affect their measurement accuracy. Lastly, histopathological examination was not carried out in most cases, leaving it unclear whether patients had additional diseases, or whether some of the lesions measured were secondary to periictal changes rather than inflammatory lesions. In conclusion, this study has identified lower T2 lesion load as a factor associated with survival, and that higher T1 post-contrast lesion load is associated with relapse risk, which may help in identifying dogs at higher risk of death or relapse. The study highlights the significance of MRI in monitoring disease progression, guiding treatment decisions, and predicting course outcomes. While limitations exist, the study's results could be applicable in a clinical setting, where decisions about more frequent re-examinations or repeating diagnostic investigations during treatment can be made to monitor identified baseline changes.